Welcome back, everyone, to Einstein's Eyes. Great to have you here again. I'm Carl Rosen, oculoplastics, neuro-ophthalmology in Anchorage, Alaska. My partner, Jon Ditkoff, will say hello in just a second, but I wanted to specify what we're talking about today. Today, we're delving into an important and emerging topic in ophthalmology, the potential link, and I say potential link, it's more of an association between the weight loss drug Ozempic, which 12 to 13% of people in the US are taking. It's a miraculous drug that slows down digestion, causes weight loss, fantastic drug for people who have a difficult time, and a serious eye condition. So an association between Ozempic, the semaglutides, that class of drug, and a serious eye condition known as non-arteritic ischemic optic neuropathy. And many of you will remember that we talked about the class of drug that Viagra's in, and Cialis also has an association with NAION. And this was discussed, and we're discussing this because a recent study in the journal JAMA, the Journal of the American Medical Association, their ophthalmology branch. They have many branches, but we're talking about the ophthalmology branch because we're an ophthalmology channel. And the latest advice from the American Academy of Ophthalmology, also known as the AAO, and the North American Neuro-Ophthalmology Society, known as NANOS, NANOS. Jon, say hello.
Hey, so how are you, everyone? I'm Jon Ditkoff. I'm a general ophthalmologist in northern New Jersey. I specialize in cornea. I trained with Carl a long time ago. It's amazing we look so good, I know, but it was a long time ago. Over 30 years ago, we trained at Einstein Eyes, hence the name, we trained at Albert Einstein, hence the name Einstein Eyes. Right. And this is a really interesting topic. I would edit a couple of things. It's not just Ozempic. Wegovy is a semaglutide. I guess there's other ones, but those are the two biggies, correct?
Well, there's other ones. Yeah, the other ones, but they're tirzepatide, so it's different.
Right,
so
different class. Semaglutide is the one that is an association. There might be with the other ones we don't know yet. So we're not necessarily saying these are bad and the others are good, but this has just been reported. So I have a lot of patients asking me about it because I have to tell you, I've had many patients on these two medications with wonderful results. I mean, they've lost weight, their sugar's amazing, they're happier people, they're doing really well. So we're not here to bash the medication at all. But I think there's a warning. Anytime there's something that's good, sometimes comes with negatives. And so the study that came out showed, so generally a non-arteritic ischemic optic neuropathy, which I'll let Carl talk about, but just to give you the percentages, that is a rare occurrence. It's 2.3 per 100,000 people. Now, the thing is, it is a disease that occurs more likely in diabetics and hypertensive and people with vascular disease. But the study showed that there was a 4 times increase incidence. So they're talking about 8 or 9 people out of 100,000. It's pretty significant when it comes to studies. So I'll let Carl talk about the disease itself. But I think, it's preliminary data, it's new data. It doesn't mean you should stop your medication by any stretch of the imagination. One thing I would add, you could argue that being on the medication is stopping you from developing all of these other diabetic related issues. But this is, new data, and we want to just warn people about it. Right. And Carl, you want to talk about AION?
Sure. Yeah, so what is NAION, non-arteritic ischemic optic neuropathy? So just for the audience, there is an arteritic variety, which is known as giant cell arteritis. That is very different. We treat that with steroids. We do biopsies usually for that, but I'm going to set that aside. So non-arteritic ischemic optic neuropathy, NAION, is a condition where blood flow to the optic nerve is blocked, and it leads to sudden and painless vision loss. That's the general symptomatology, painless and sudden vision loss. The symptoms include blurred vision, color distortion. The color red can disappear, it can look brown. You can lose your peripheral vision, you can lose your central vision, which is more devastating, obviously. You can see a dark spot or a gray spot in your vision. And you also lose contrast or light sensitivity. And that's very annoying as well. So folks who lose contrast sensitivity have a really hard time in the fog. They can't see anything. So the take home though is that NAION usually occurs without warning. And it usually happens in folks who have this condition called metabolic syndrome, where, as John mentioned, they're diabetic, they have hypertension, they have sleep apnea with low oxygenation at night, they have high triglycerides, high cholesterol, and they tend to be overweight. Now, one other thing that neuro-ophthalmologists all know about, ophthalmologists do get this in their training, as do neurologists, but mostly neuro-ophthalmologists look for it, is something called a disc at risk. It's a small crowded optic nerve that predisposes someone, so anatomically predisposes you to this condition. That's why you want to have it looked at, and that can be helpful in sort of consenting to taking this medication. Now, as I mentioned, this is just an association. This was done by a Harvard crew in a very large hospital, one of the Harvard hospitals in Boston, and it's just one study. So we obviously need more data and more analysis before we can say, yes, this is probabilistically very likely or statistically very likely. So we're gonna hold off on that. So the recommendations are basically don't panic, be vigilant, consult your doctor, and just understand the risks. But we would also say that this is an amazing class of drug. And it slows down digestion, it makes you lose weight, and then the side effect is that you have all these other great things that happen by losing the weight. You protect your heart, you reduce the likelihood of diabetes, kidney disease, a bunch of other things. So I would say stay tuned. Einstein's eyes will keep you informed. And John, anything else?
Yeah, I mean, kind of a couple of cool things that I've learned recently. Number one, supermarkets are being affected by how great these drugs are. My understanding is they're stocking supermarkets differently because a lot of people that used to be eating all these snacks and craving all this stuff are not using it. They're just not buying as much. So it's really interesting how it's affecting the food industry. And as Carl said, there's a lot of good things about this medication. I mean, it's been miraculous for so many people that have had trouble losing weight and controlling their diabetes. But I still think, we're just hoping this is not the tip of the iceberg, that there's problems. But again, I would emphasize, we're not telling you not to use it. I think if you did have a question, you ask your doctor. I would tell you right now, if someone asked me right now, I heard there's a risk of an AION, which by the way is like a stroke to your eye. I would say, yeah, there's a risk of a stroke to your eye if you stay overweight with diabetes. So it's really hard to compare it right now until we have a huge study, which could take years.
Right. But here at Einstein's Eyes, we're going to do our best to keep you informed, up to date. So thank you for being here, folks. Please like and subscribe, and we will see you on the next one. Thank you.